In 1990, I was ready to get out of the profession of pharmacy. Luckily, I was introduced to pharmacy compounding. And I can tell you, I would not be a pharmacist today if I wouldn't have discovered pharmacy compounding. It is a big part of our practice. It saved my profession. It's the thing that I love to do the most. All of our staff in the lab are pet owners. It's not a requirement, but it just works out that way. And about 25 to 30% of the prescription compounds we prepare is for companion animals: cats, dogs, ferrets, rabbits, birds. We do some work for the Humane Society, some of the pet rescues. It is a major part of our practice. It's something that when we joined the Professional Compounding Centers of America, they sent a gentleman by the name of R.T. to train me. And part of my training was to go to visit prescribers. The very first prescriber that we went to visit when he came to train me was a veterinarian. He was our vet. It was the vet that we used as a family. And the very next day, he sent a prescription for a compound for a tuna-flavored treat for a cat. The very first compound that we did as what we considered a compounding pharmacy was for a cat. And it just changed the focus of how we did things. And today there can be nothing more true that vet compounding is a huge part of our compounding practice. We do many things. We do capsules, we do flavored treats, flavored liquids. It's not uncommon to put together a flavored liquid with a measured dose syringe so that the pet owner can measure that dose and administer that. We teach owners to use a treat, give the medicine, follow with the treat, all sorts of things that enable those owners to properly administer that medication. Drugs have a taste, so you do have to be a little bit creative in the administration of that. But that's our strength. Our strength is identifying what that animal will accept, what flavor do they like. We oftentimes ask owners, is there a treat that this cat likes? Is there a treat that your dog really likes? My favorite vet story is we had a cat who we just could not get him to take the medication. And I asked the owner on about the third or fourth try, is there something unusual that this cat likes? And I don't remember the name anymore. And she said, interestingly enough, he likes black olives. And I'm like, okay. So I went and got a can of black olives. I drained off the juice. We used the black olive juice to flavor the medication for that drug that this guy needed. And he took it every time until that prescription was completed. So it's just a really wonderful profession to be involved with. My staff loves to service the vet community. We do some work for the zoo. Every once in a while, we'll prepare a medication for a zoo animal. We did something for some tigers that were on exhibit one time, which allowed me to actually get in and communicate in person with these animals. So there's some rewards other than just the reward of helping somebody. So Dakota Precision Rx Labs, we're your experts in veterinary compounding.